Welcome to this episode of HCA Talks Health. I'm your host, Zena Le Roux, and today I have Dr. Maricia Coertze with me as a guest. So, Dr. Maricia is currently internationally certified as an advanced functional medicine practitioner, and she also completed her advanced diploma in aesthetic medicine. So, for you, a holistic, individualized patient care is really key, right? When you take on any medical case. And this is really because you believe that each individual is unique and should also medically be treated according to their uniqueness. So you don't just take a one-size-fits-all approach. And you also believe in enabling patients to achieve balance in all fields of their lives, right? It's about balancing mental health and physical health, making lifestyle changes, or maybe even improving fitness. So welcome, Maricia. It really is a privilege to have you on the show today.
Thanks for having me.
Yeah, so it's quite an interesting combination, when thinking about all the specialities that you've got. So you're a functional medicine doctor, but you also do a lot of work in aesthetics. So do you find that these two areas complement each other? Do you find that they can work together in your practice?
Strangely enough, yes. So I started off, just as some background, I started off in aesthetics, so mainly beauty, and that's how I got introduced to integrative medicine, funny enough, because it goes hand in hand with managing chronic skin conditions. So that was my introduction to integrative medicine, and then I kind of found an acclimation towards it, and then I went deeply into it because I love it. I love health and fitness as well. And I mean, I'm a medical doctor, so it's a good thing. It should be an interest of mine, so I'm glad that it is. But then I started incorporating the two, and because I mainly work with skin, that's usually where my focus is, and integrating holistic wellness to create aesthetic results, but also long-term health results, which that's what I do now. It's basically holistic aesthetic medicine. I don't really know what else to say about that. It is what it is. And yeah, so that's kind of how it played out for me.
Wonderful, but it's quite a unique angle. I love that. So you realized that when you were working in aesthetics, that managing chronic skin conditions is not just something that you can treat from an external. You can't just treat it in an external way. It needs to come internally as well.
Just to wrinkle that one out, you can. Absolutely, you can. Okay. But in order for people to control the condition long term, you need to address the health. And in order to get them off of the prescription formulations, you have to control the health to clear up the issue. And I'm sure you can relate to that from a functional perspective. You have to get to the root cause. So I find that in my practice, like, there are some patients who aren't usually open towards a functional approach and really delving deep to find the root cause of the issue. And for those people, they're more than happy to stay on the prescription formulations to control the symptoms. But when it comes to me, I try to convince the majority of my patients to do it the right way and to address their health issues because of the benefits that it has long term on their general well-being. So yeah, that's my approach.
Yes. Okay, so for you to see the best result sustainably, you find that it's a combination of the two. Okay, so let's just start with the aesthetic side of things. So what are the main treatments that you typically do as an aesthetic doctor?
For me, I work very closely with my therapists. They're all medical aesthetic dermatologists, senior therapists. They've been working with patients for a long time. So I usually see patients for the first time. When they come in for the first time, I do a general assessment of their skin, and then we do a treatment plan for them. So it depends on what they want, what their needs are, and also what their financial means are like. When it comes to physical treatments, I would do the medical grade treatments that are only allocated to doctors, like your deeper chemical peels and some of the advanced laser treatments I would do. Otherwise, I delegate most of the in-house treatments that involve chemical peels, laser, microneedling towards the therapists, but then I largely focus on injectable treatments. So those would be your your botulinum toxin injections, your dermal filler injections, your biostimulators, the list goes on, and the industry grows so quickly. So I can literally spend the whole session talking just about that. But so for me, largely, my focus is largely on injectable treatments and reversing signs of aging from an aesthetic point of view. Yes.
And so, do you find as a functional medicine doctor that some of those injectable treatments, could any of those treatments, have you seen that those treatments could impact people's health in any way?
To
No?
date, so I've been practicing full time as an aesthetic doctor for 10 years now. And it's never have I had an issue. The only thing that can happen, but we usually screen people for this, is people with autoimmune conditions. When the autoimmune condition is not very well controlled, or if someone has like a little bit of an overactive immune system, like an atopic person who would be prone to developing allergies, we do sometimes see a little bit more swelling when we inject filler, and sometimes nodule formulation. But apart from that, no, it doesn't really have any long-term complications. Remember, like botulinum toxin is it's a scheduled drug. Okay, so it was, and people are usually concerned about that, because why is it a toxin that you inject into your body? It doesn't make sense, right? But it's a deactivated toxin. So we just use it for the side effect, which is muscle relaxation. So just for some background, botulinum toxin was developed as a treatment modality for children with cerebral palsy who have muscle contractures, to relax those muscle contractures. And somewhere along the way, they've discovered that, oh, hi, it has great aesthetic benefits. And then it's kind of become a dominant thing in the industry. So it's very safe. It's thoroughly tested. There are many clinical trials to prove the safety of the drug. And in South Africa, it can only be administered by doctors and dentists. When it comes to hyaluronic acid and the other compounds that we do inject physically into the skin, those are all sterile preparations. Okay, so it's very safe. It's non-surgical and non-permanent. So in the past, there were dodgy fillers that were made of silicone. Those things we definitely don't do anymore. Those had some long-term complications. But the products that we use today, they don't usually last more than 2 years. It's made from pure hyaluronic acid. The dermal fillers, which is made by your body on a daily basis, like you know, so it's reabsorbed as if it was an internal serum. So yeah, no, it's been a very smooth sailing route so far. We haven't seen any hectic issues from a health perspective with these treatments. But again, it's also operator dependent. So people need to be aware of going to the right people to inject or to have these treatments done. Competent injectors who know what they're doing, who respect the anatomy, and not to cause any long-term health issues.
Okay, so you mentioned that it's a deactivated toxin, because I think from a functional medicine or functional perspective, often people work so hard to not get any toxins or chemicals in the body, right? They try to eat really clean and make sure that it's whole natural food. So this is not the same thing, right? It's not the same type of toxin.
No, so it's actually like it's a protein that's used from the botulinum toxin substrate. Okay, and what it does is, the only thing that it does is it actually disrupts communication between the nerve endpoints that are supposed to stimulate the muscle to contract. Okay, so it goes and interrupts that signal, and your body actually forms new nerve endings to stimulate the muscle again. That's why botulinum toxin doesn't really last more than 6 months once it's been injected, because your body kind of works around it. Okay. So no, it's like certain parts of the botulinum toxin substrates have been taken, it's been modified and compounded to create the injectable drug that we use for aesthetic reasons. treatments.
Wonderful. Okay. Yeah, so I'm sure that people can really rest assured that their
Yes,
long-term
no, it's
health is
so
not impacted when they're signing
yeah,
up for these types of treatments, right?
yes.
So one other thing that comes to mind, just thinking about something we often also address in functional medicine, is of course the microbiome, and we know that there's lots of live bacteria on the skin as well, right? So
Yes.
what happens to the skin microbiome when we do something like a chemical peel or dermapen, something like that?
Okay, so like it's not only the microbiome that's on the skin on a daily basis, right? Throughout the day, you do accumulate some pathogens that you really don't want on the skin. And the important thing to take into consideration, or not to, I don't want to take the stress or the focus away from the microbiome, but the skin barrier is more important than worrying about the skin microbiome, because that's the most common issue with people because of the inflammatory load that people has on a daily basis at the moment, like it disrupts the protective barrier inside the skin. And once that barrier is disrupted, normal bacteria actually become pathogenic. And that's why we have so many cases of acne, of pigmentation, of skin sensitivity, of eczema, of psoriasis, things like that. It's because of barrier dysfunction. But when you look at the microbiome on the skin, those little microorganisms are very clever, and they are very tightly attached to the collagen fibers actually in your skin. So even if you do have a chemical peel, and I'm talking now like normal maintenance chemical peels. I'm not talking about the deep peels that you have to go into theater for with a general anesthetic. I'm talking about your daily in-salon regular chemical peel with no major downtime. It doesn't disrupt the microbiome to an extent that you actively have to replace microorganisms on your skin to keep the microbiome intact. Those bacteria that are left behind after a treatment replicate so quickly. I mean, it takes 20 minutes to create millions of bacteria again. So the microbiome reestablishes itself very quickly as long as you have a well-functioning skin barrier. So in practice, I usually focus densely on barrier restoration to get the skin barrier going and to ensure that we have an intact skin barrier, because then I know like infection or sensitivity won't be an issue when we actually have to get some treatment modalities on board to create the desired clinical effect. Does that make sense?
Yes, absolutely.
And also, those microbiome organisms they survive in really acidic environments. Okay, so the skin surface is supposed to be very acidic when you look at the pH. Okay, and skins that usually don't have a very well-functioning protective barrier have a more basic pH. Okay, so then the survival environment for the desired microbiome organisms are unfavorable anyway. So that's why I say it's important to focus, before you focus on the microbiome, it's important to focus on skin barrier function, because otherwise the environment's anyway not right
Yes, I hear
for
you.
ensuring that the microbiome is functional.
So what are the typical things that you look at for skin barrier restoration or
So
function?
So it takes a clinical eye. So luckily I have experience behind me to see whether I'm dealing with an impaired barrier. But people will usually complain of, they can't really use any product. Sunscreen is usually a big thing that pops up that burns people's faces. So if a sunscreen's burning your face, it means that there's oversensitivity in the skin. And we kind of need to look at why is the skin reacting to a very basic product. So the skin is usually really robust. Okay, it's supposed to be able to withstand quite harsh conditions. If you look at a primal point of view, what our ancestors were exposed to, they were exposed to extreme weather conditions without any help from any cosmetic products or shields or anything like that. So any sign of skin sensitivity, any adult acne is a telltale sign of impaired barrier. Unusual pigmentation or discoloration, uneven skin tone is usually a sign. Redness, rosacea, like flaring, flushing, those kinds of things are all signs of an impaired barrier.
Okay. So yes, the skin sensitivities and specifically you mentioned adult acne. I think it's something that's becoming more common, or is it something that you've seen over the years? Is it featuring more
Yes,
recently? Yeah, it's not just a teenager
yes.
thing, as we perhaps
No,
used to believe.
and sadly, like, and I see this in so many of my patients, like they come in and they say, oh, I've acne like a teenager, and I'm like, for instance, 35 years old, and I shouldn't be getting acne anymore. And it's inflammatory. And many people are told that it's hormonal. Yes, okay, it's hormonal, but why is it hormonal? It's because of the underlying inflammation that causes hormonal imbalances and barrier disruption that then causes acne. And what do people do then? They go onto teenage, like oil control products. They scrub the living daylights out of their skin, like mechanical exfoliations, and it just gets worse and worse and worse.
Yeah.
And what you should actually be doing is you should be calming the skin down, no chemical exfoliation, nourish the barrier, get hydration into the skin. Let's restore the barrier. And as soon as you do that, you already see like a 50% improvement in the skin when it comes to acne. And then obviously we need to go and have a look at like, why is there hormonal havoc? Why is there no homeostasis? Like, and that's where functional medicine comes in. So coming back to your first question, those two tie in really well. And I use it on a daily basis to really get a good clinical outcomes and a sustainable outcomes for my patients.
Yeah. And then, of course, I think the two main things, or maybe you can correct me, but some important things for many people nowadays is, of course, things like acne, but also aging and healthy aging, um, especially the specific. The signs of aging that might be problematic to people as they're getting older. So what is, from a natural perspective, so from a functional medicine perspective, is there anything that you would recommend to slow down the signs of aging for people?
Yes, absolutely.
Yeah.
And this is also something that I see every day. We are kind of conditioned from a young age that there is no such thing as a ceiling. Everyone is always pushing the ceiling in terms of performance, and everyone's on the go and everyone's rushing and overstressed. So definitely number one that I would say is scale back, schedule time for rest and recovery. Nobody's going into a parasympathetic nervous state anymore. Everybody's like in the sympathetic drive. It leads to an overaccumulation of reactive oxygen species. People are not detoxing well anymore because their body just can't go into a physiological state for heal and repair. So that's usually my first thing that I tell patients. It's like, just take a step back, relax, have couch potato days, get in the sun, take naps, stretch. Don't train yourself into a different dimension of space-time reality. Like, just go for a walk outside, like get into nature. People don't do that anymore, and we need that. We need that as human beings to ground and to, recover and rebuild. And that's why we see such a huge increase in, musculoskeletal issues like chronic pain. If people's collagen are not regenerating, we're getting joint issues, we're getting a lot of arthritis from a young age. Everyone's walking around with back pain. Everybody's walking around with knee pain or injuries. And it's going back to basics. Make sure you have good nutrition on board. Eat a whole foods diet, eat the rainbow, eat more than 5 servings of fruits and vegetables every day. Get your animal proteins in there. Sorry for the vegans, but like, we need those vitamins and minerals that are densely packed in animal proteins. Get enough water. Make sure that you drink good quality water. Like, most of our natural springs are contaminated with all kinds of hormones and pesticides and contraceptives. Get filtered water loaded with electrolytes. Make sure you get your electrolytes in there. Otherwise, you're just dehydrating yourself from the outside in and inside out. Get good quality sleep, 8 hours of sleep every day, like the basics. Get enough movement, stand up from your desk. We're all desk bound or traffic bound. Just get your body into a state where it was supposed to be in from a primal point of view. And that's usually 80% of the way out. I'm not sure if you agree with me. If you agree with me, but when I see my patients like implementing these changes, like, we get insane results. And it's literally going back to basics. Like, there is no magic cure. It's like you are already the magic cure. I find that everybody's body is capable of healing if you put it in the right environment, and that's what will prevent aging. Like, get tissue regeneration and tissue rebuilding optimized, and you won't have an accelerating aging process because healing and repairing is taking place.
Yeah, I love that. And it's so interesting because I think sometimes people are putting themselves under a lot of stress in the name of health. You know, they're doing the intense
Yeah.
workouts, they're doing the high intensity
Yes.
interval trainings, but they're already stressed in their life. They may be fasting, and it might just be too much of a stressor on the
Yes,
system.
I see that so much.
Yeah.
Because it's like, it's such a buzzword at the moment, especially on social media. Like, everybody should be intermittent fasting, and then it's all these hectic fasting protocols. And the majority of my patients are female. And, you know, like, nobody knows that, okay, half of women that I see are not tracking their menstrual cycle, right? I'm like, what do I like? This is so important.
Yes, yes.
And as females, you should be fasting according to your menstrual cycle. Like, your hormones are not the same on a given day. I'm not talking women on, not on hormone replacement, which includes the pill. Okay, your hormones fluctuate every single day. Like, there's literally not a single day where your hormones are on the same level. And estrogen and progesterone prefer different nutritional environments. Like, you should not be fasting in the luteal phase of your menstrual cycle. Your hormones are like, progesterone is your dominant hormone. Progesterone likes a carbohydrate dense environment. It does not like fasting. Your blood sugar will be unstable. You will be tired. You should not be pushing it in the gym in the second phase of your menstrual cycle. In the first phase, yes, go ketogenic. There you can put your fasting cycles in. There you can put your high intensity training in. But second phase, no, you should chill. Couch potatoes, phase 2. Phase 1, you can conquer the world because your hormones are right for that.
Yes.
So yes, like, and I see a lot of women who are like really pushing the limits when it comes to intermittent fasting, and it's actually adding to the stress burden and accelerating the signs of aging. And I usually pull them right out of their fasting schedule. And once you push food in there, all the symptoms start to disappear.
Exactly, and it's almost as if they
So,
feel like it's the responsible thing to do. It's almost, you know, there's some shame linked to if I do have breakfast. You know, it's kind of become so popular, like you
yes,
said, on social media,
yes,
and that's sometimes the least beneficial thing for especially women to do. And interestingly enough, and maybe you can correct me if I'm wrong, but it seems like most of the research for training in a fasted state has been done on men, you know, so it's
yes.
not so
Most
much
training,
beneficial. Okay.
most research done in sport has been done on men.
Yes.
Women should not be training like men. Like, our
No.
hormones do not agree with that.
Yes,
And it's been
exactly.
like that for centuries. So that's why
Yeah.
we have so many cases of PCOS, is because an undiagnosed PCOS, like, it's because of that.
Yeah, exactly. All right. So even when it comes to, I mean, yes, the physical signs of aging in terms of inflammation or joint pain, arthritis, injuries, but also something as basic as wrinkles, right, on the face. If
Yes.
in the face, if you are going into your sympathetic nervous system state too often, then it could even impact aesthetics, right? That's
Yes,
what you're
definitely.
saying. Mm.
Yes, because tissue breakdown. So in a sympathetic state, the your body doesn't prioritize rest and recovery. Like I said, it needs to go into a parasympathetic state to go into rest and digest and out of fight, flight, freeze. So that's why there are so many digestive issues as well, because people were stuck in sympathetic drive. So getting into a parasympathetic state, getting the nutrients into the body, actually utilizing the proteins that you consume for tissue rebuilding and regeneration, you can automatically see the difference in people. And I love to see it. And I've started actually taking pictures of my patients when we start the functional journey. And like 8 weeks into the protocol, I take a picture again, and you can't believe the difference in their skin complexion.
Oh, I
And
can
then I haven't done
imagine.
anything aesthetic, like, just by actually nourishing, nurturing the body, what a difference it makes in the appearance of their skin.
Oh,
It's
I can
incredible.
imagine. Yeah. So, where can people find you? Where are you based currently? How can they reach out to you if they need your support?
So the easiest would be go look at my Instagram handle at Dr. Maricia. And all my details are on there. They can just shoot me a DM. My contact details are on there as well. And then I'm usually on it very quickly within a day, except for when I have a really busy day in practice. But I always have access to my account, and then we can chat from there.
Okay, lovely. And is there maybe one last thing that you want to leave our listeners with when it comes to skin health from a functional perspective? Anything that you maybe want to leave them with before we end off?
Prioritize nutrition. Like I cannot emphasize this enough. Like the amount of people I see who are chronically under eating is shocking. Eat and eat and eat more than you think you should. Like the more you eat, the better you build up your metabolism, the more nutrients you provide your body to actually like arm it to do what it was designed to do. Really, like that's the hardest thing for my patients to get used to, is the amount of food that I give them to eat. But eat as much as you can, but eat good quality food, like eat simple foods that don't require a lot of processing or cooking. It's like just stick to your veggies, your meats, your good oils, like your olive oil, like just drizzle that over everything. Like your body loves monounsaturated fats. It's very anti-inflammatory, but eat as much as you can of good quality foods. And rest, make time for rest.
Yes, so it's really that nutrient dense foods, right? Really prioritize them and prioritize rest. I love that as a takeaway. Okay, so thank you, Dr. Maricia. You really have got a wonderful approach to skin health and aging with that functional medicine background, and just knowing how important it is. I love that you know how important it is to take the individual into account as well, right? When you're looking at skin treatments. So thank you for your insights, and all the best with everything that's currently on your plate. I know that there's a lot going on for you usually. So all the best.
Thank you so much. It was such a pleasure talking with you.